Question 2, on critical public health issues. In light of controversies surrounding COVID mitigation policies within the community and reflected in the board's current actions, what is your stance on public health issues with respect to governmental requirements for critical safety protocols such as masking, testing, and vaccination? Please address the associated issues considered when arriving at your opinions.
Thank you. This is one of the most divisive topics in our community today. At the forefront, we've seen passionate debates at our board meetings, particularly between two vocal groups who I think are unfairly labeled pro-mask and anti-mask. But what we truly have is an entire community struggling with the balance between public health and the negative impact that masks have in the educational setting. To answer this question properly, I feel it requires two responses. First, as a parent, the second, as a trustee. And as a parent, it's a complex discussion requiring the consumption of a torrent of information, often contradicting, and we're forced to make important personal decisions that affect ourselves and our children. My wife and I discussed early on in the process whether we would be vaccinated, and my wife is a teacher. I travel for work, and we agreed that we would do it, sort of balancing out the risk of the vaccine versus the benefit of having some protection. We also had the same discussion when my son, who is 13 years old, was going back into school for 8th grade, and we had that conversation amongst the three of us. We talked about the vaccine, and ultimately the decision was to allow him to be vaccinated before he went back to school. Both of my children have been wearing masks, as is everyone else in the district, and they've been adjusting to it, but we believe that it's having an impact on their educational experience. So I think it's important to talk about what I believe should happen, and I believe that between now and the first week of November, the CDC and the FDA will approve the use of the vaccine for children 5 and up. It's important. That's a critical number. Almost all our students in our population are ages 5 and above, and that will give parents an option to get an extra layer of protection against the COVID vaccine. Against the COVID virus, and also, I expect there'll be enough time given to allow parents to get vaccinated, their children to get vaccinated, and then we'll talk about whether or not the governor will rescind Executive Order 251. I think it will give parents who want to have a double layer of protection the option to do so, and that's important. You can wear masks, you can also get a vaccine. In the case of how I would respond as a trustee, it's far more straightforward. Executive Order 251 is in essence law, and as such, it can only be challenged or circumvented in some cases by districts if they successfully challenge it in the courts. And to date, no district has successfully won a challenge against Executive Order 251. Any decision by a district to try and circumvent Executive Order 251 puts that district at litigation risk. And litigation risk ultimately would cost taxpayer dollars to defend against. As a trustee, it's a responsibility to ensure that we do not put ourselves in a position where we find ourselves in litigation and ultimately cost taxpayer dollars to defend ourselves. I believe that the trustee decision is fairly straightforward, and that's how I believe we should treat it.